A very good morning to you, everyone. It's been a while since I came live, and when we start a journey, you must finish, and whatever that you have started, you must be ready to complete. Ladies and gentlemen, this morning, I want to talk about 3-4 things in a nutshell. I'll take about 10 to 20 minutes, because we have to get back to work. And first on the list, Mpox. Mpox is still here with us. So do not think that you are out of the hook. We still have Mpox cases in the country, and I want to urge each and every person to continue taking care of themselves. First and foremost is to say that we still have 14 confirmed cases in the country. Nakuru, they have 2. Kajiado, they have 2. Bungoma, 2. Taita Taveta, 1. Busia, 1. Nairobi, 1. Mombasa, 1. Makueni, 1. Kericho, 1. And Kilifi and Uasin Gishu, 1, respectively. We only have 1 death that has occurred to an individual who had Mpox. However, this person had already been treated, and he died while he was at home. Our National Public Health Labs have received 254 samples, 14 which are positive, 238 negative, and 3 are still pending in the lab, and that is going by yesterday. 83 contacts have been listed, and 63 have been followed up to 21 days. I told you the last time, ladies and gentlemen, that once we identify a case, we must do contact tracing, what you call contact tracing, that whoever or wherever that person passed through, we must get the people who are in the circle and ensure that they are equally tested in our labs. 63 have been followed in the last 21 days, and 3 tested positive for Mpox. So it's not in vain, because once you follow these people, some of them will come out as positive cases. 17 are still being followed up as at yesterday. So let us keep calm, because we will be able to share the results very soon. Now, 14,821 travelers have been screened at the ports of entry in the last 24 hours. Meaning since Wednesday, we have been able to screen, actually Tuesday, we've been able to screen 14,821. And culminatively, we've been able to screen 1,489,490 people at the ports of entry. 421 people have been sensitized about Mpox. Now, I have about 50 to 100 people on this online. I am sensitizing you on issues of Mpox, that you must take care of yourself if you're going out of the country or coming in. You've been in a porous area, please ensure you get tested. If you get signs and symptoms, please get tested and ensure that you are keeping safe. Don't share clothes, because this disease is going to be spread through contact. Don't shake hands with somebody who has been suspected or who we have already confirmed. Our risk communication messages, which have been approved, they've been going out, they've been reaching you, and if they are not reaching you, please leave your message and we shall be able to send them to you. Coordination between stakeholders, ourselves, the county government, the donors, the development partners, that is, private sector and the county government. We already have a task force that is taking charge of this, and that is why we have been able to remain calm in the country, and I so hope that this is going to continue. We are going to do all we can to ensure we protect our country and her citizens. Surveillance is ongoing, and especially along the border. We will continue doing this, and culminatively, number of people sensitized to Mpox is 421,364, and disease surveillance has been enhanced in all counties. I have talked about the laboratory samples that we have been able to do, about risk communication. Ladies and gentlemen, please note that there is Mpox. Monkeypox. Take care of yourself. Wash your hands at all times. Do not share clothing or do not share bathing towels. Ensure this message reaches out to your people, the people that you care about, the people around your circle, the people who you work with. I want to talk about another disease that we have not discussed in the recent past, tuberculosis. I want to tell you that tuberculosis, leprosy, and lung disease, we have a program in our State Department, the State Department for Public Health and Professional Standards. And in the last few years, we have been able to achieve a number of things. Remember, tuberculosis can equally be linked to other diseases like HIV. You know, it's a ripple effect. Therefore, in our State Department and on behalf of the ministry, we have been able to enhance diagnostic approaches for tuberculosis. We have leveraged on technology by deploying artificial intelligence for interpretation of digital chest X-rays in 55 health facilities in Kenya. Our target through our resource mobilization is to ensure that all our health facilities, more than 5,000 health facilities, we can be able to deploy this kind of artificial intelligence to interpret chest X-rays. We have also improved the gene expert utilization rate from 33% in 2022 to 59% in 2023. And the program again has scaled up access to WHO approved molecular diagnostics test through the support from Global Fund, and we have received equipment, about 38 of them. Ladies and gentlemen, the treatment outcomes for TB have improved in this country. And I want to tell you how that the program, which is under the State Department, has achieved the overall TB treatment success rate by 89%, an increase from 87% in 2021. To the program manager and other